my name is Abby Sine, and I'm going to be doing a postpartum assessment on this. So to start off, I would come in, I would wash my hands, I would provide the mom privacy, I would verify her name, her date of birth, and then I would begin doing her vital signs. So I would take her blood pressure, I would check her pulses, I would count her respiratory rate, I would check her pulse ox, and I would ask her what her pain was on a scale of 0 to 10. And then after I did this, I could start my modified postpartum assessment. So I'm going to do that. Knock, knock. Provide privacy. Wash my hands. Hi, my name's Abby. I'm going to be the nurse today doing your postpartum assessment. Can you verify your name and date of birth for me? Okay, great. I'm just going to start by taking your vital signs, and then we'll begin the assessment. So like I said, blood pressure, put the blood pressure cuff on her arm, check her pulses, both radial pulses, and while I'm taking that, I'll count her breaths. And then I will say, do you have any pain on a scale of 0 to 10? Okay. And then I will move into my assessment. So I would start by looking at the breasts. I would palpate the breasts for any spots, any lumps, any tenderness, and I would ask the patient, do you have any pain in your breasts, any discomfort? And they would say yes or no. I would say, are you breastfeeding? And if they say yes, I would say, do you have any discharge? Do you have any cracking, any redness around your nipples? And then I would palpate and feel. And then after that, I would move down to the uterus. I would sit the mom would be sitting up in bed. I would lay her flat to palpate the fundus. I would keep the legs down. I would put one hand on the symphysis pubis to stabilize it because I wouldn't want to actually turn the fundus while I'm palpating it. So I will keep one hand here to stabilize it, and I will palpate to find the top of the fundus, and it should be firm. It shouldn't feel boggy or anything. And I would, this would be a good teaching point too for the patient. I would say, can you feel your fundus? Like if you have any, you should be able to feel it, and it should be firm. Is it midline? Is it in the middle, or is it displaced on one of the sides? And then the height from the umbilicus. It would be important for me to note that. And then next, I'm gonna go ahead and I would go ahead and listen to the lung sounds and the heart sounds and the bowel sounds to make sure that they are all present. Okay, and the reason that I would auscultate all of those, the bowel sounds, is to be sure that, I hope this is still working, is to be sure that when I palpate the bladder, I don't actually mess anything up or dislodge something. So after I auscultate the breath, the lung sounds, the heart sounds, and the bowel sounds, I will then move on in my assessment to the bladder. Well, first, actually, I would do the bowel sounds. I would ask her questions. I would say, have you had a bowel movement since birth or since labor? She might say no, and this is actually a normal finding since constipation can be a side effect after labor, so it's normal if she hasn't had one yet. I would ask her if she's having any stomach pain, is she passing gas, that kind of thing. And then I would palpate her stomach, feel for any lumps, discomfort, pain. Then I'll move to the bladder. In the bladder, I would say, have you been able to urinate? Have you been having any trouble urinating? Do you find pain while you're urinating? Do you have any odor? Does it look a different color? Is there any blood in the urine? All these things would be important to ask, because if it was hurtful and painful to urinate for the patient, it could indicate a UTI. And then I would check kind of the diaper, because I'm looking for the lochia, the blood that they have discharged after labor. I would ask when the last time their diaper was changed, the pad was changed, and just make sure that there's no signs of hemorrhaging. And then it would be important for me to chart and make note of the amount of blood that they have. I would make sure there's no clotting in the blood, make sure that it's a red color, and not anything indicating hemorrhaging. And then next, I would look at her perineum, make sure if she had an episiotomy naturally, or if the doctor had to cut it. I would ask, was the tear natural, or did the doctor make the tear? And then I would look at it, make sure that it was healing all right, no signs of infection or anything, make sure there's no pain in that area. And then I would check her lower extremities, and this is important because if there's unilateral swelling, it could indicate a DVT, and so that would be important to know. I would check both the legs for swelling, any warmth to the touch, any redness, and I would check the femoral pulses and dorsalis pedis pulses to make sure that she is getting blood to her extremities. And then after that, I would complete my assessment. I would be sure to make note of her emotional status while I did the assessment. Is she distressed? Is she crying? Is she tearful? Is she anxious? Or is she happy and excited and talkative? These would all be important things to note and to make note of in the patient's chart. So this will complete my postpartum assessment. Thank you.